Good day, everyone. I'm Jonalyn Ganov
And I'm Divine M. Dag-uman
from BSN2-F, a member of Gr.2. And today, we will be discussing all about endocrine drugs. The first drug is thyroid drugs. Thyroid drugs are used to supplement low thyroid levels in people with hypothyroidism. And we have here the generic name and the brand name. The generic name is levothyroxine, and the brand name is Synthroid Levoxyl Unithroid. The mechanism of actions are increases heart rate, cardiac contractility, and cardiac output. They also promote vasodilation, which leads to enhanced blood flow to many organs. Central nervous system, both decreased and increased concentrations of thyroid hormones lead to alterations in mental state. The major adverse effects are nausea and vomiting, signs of increased metabolism, tachycardia, hypertension, cardiac arrhythmias, anxiety, headache, tremors, and palpitations.
Nursing consideration and its rationale. So the nursing considerations are: first, monitor weight and vital signs. The rationale is to obtain baseline data. Next is instruct client to take daily medication the same time each morning without food. The rationale is to ensure consistent therapeutic level. Next is monitor blood test to check the activity of thyroid. The rationale is to monitor the efficacy of treatment and to ensure that the correct levels of the medication administered are maintained. Next is advice to report palpitation, tachycardia, and chest pain. The rationale is to prevent toxic overdose. And lastly, instruct to avoid foods that inhibit thyroid secretions like cabbage, spinach, and radishes. And the rationale is mentioned foods may bind levothyroxine and prevent complete absorption. The next drug is anti-thyroid. So we have here the generic name and brand name. The first is metimazole and the brand name is tapazole. Propyluracil and the brand name is propacil. Next is carbimazole and the brand name is neomercazole. The mechanism of action is inhibits synthesis of thyroid hormones by acting against iodide organification. Major adverse effects. The side effects of thiamides are envy, drowsiness, lethargy, bradycardia, skin rash, gastrointestinal complaints, arthralgia, and myalgia. Most important to monitor for granulocytosis. The side effects of iodine solutions, Lugol's. Most common adverse effect is hypothyroidism, iodism, metallic taste, burning in the mouth, sore teeth and gums, diarrhea, and stomach upset. The nursing consideration and its rationale. The first nursing consideration is monitor vital signs, T3, T4, and weight. The rationale is to watch the evidence of hypothyroidism and notify the prescriber if it is arise. Next is the medications should be with meals, and the rationale is to avoid potential for liver damage. Next is instruct to report sore throat or unexplained fever, and the rationale is to notify the prescriber because the patient may need to dosage adjustment. Next is monitor for signs of hypothyroidism, and the rationale is to keep the drugs interact the body and to ensure the effectiveness of the drug. Next is instruct not to stop abrupt medication. Next is used to decrease the vascularity and size of the thyroid, and the rationale is to decrease the flow during the surgery. Next is T3 and T4 production diminishes, and the rationale is to make the heart rate normalize and to avoid the rapid heart rate. Next is given per orem, can be diluted with juice, administered with foods. The rationale is to avoid staining. And next is use straw to decrease staining, and the rationale is to let the patient less staining, especially in the teeth, which can cause teeth problem. And lastly is monitor iodism. The rationale is to make sure that the drug are effective because iodine make the drug less effective. The next drug is steroids. The generic name and brand name are first dexamethasone and the brand name is Dexpac. Next is methylprednisolone and the brand name is Medrol, Depomedrol, and Solumedrol. Lastly is prednisone. The brand name is prednisone intensol. The mechanism of action is suppresses inflammation and the normal immune response. The major adverse effects are hyperglycemia, increased susceptibility to infection, hypokalemia, edema, peptic ulceration, if high doses, osteoporosis, growth retardation, peptic ulcer, hypertension, cataract, mood changes, hirsutism, and fragile skin. The nursing consideration and its rationale. The nursing consideration and its rationale. The nursing considerations are first, monitor vital signs, electrolytes, and glucose. The rationale is may cause hyperglycemia, especially in patients with diabetes. Next is monitor weight, edema, input or output. The rationale is observe patient for peripheral edema, steady weight gain, rales or crackles, or dyspnea. Notify healthcare professional should this occur. Next is instruct to take meds with meals. The rationale is to avoid any complication. Next is caution the patient not to abruptly stop the drug. And its rationale is to reduce the side effects of indigestion, stomach irritation. Next is drug is tapered. The rationale is it may result in increased hospitalization and premature death. Advise the patient if side effects are felt and call the physician immediately. And lastly is evaluation. The drugs are effective if there is relief of signs and symptoms of inflammation and return of adrenal function to normal. The rationale is for our body not to be directly affected due to the drug dose that has been stopped suddenly.
So the next one is the anti-diabetic drugs. So the major adverse effects is the lispro, hyperglycemia and ketoacidosis, local reactions at the ejection site or lipodystrophy, and seizures. It also includes regular insulin like sweating, dizziness or lightheadedness, and also hunger. And also NPH and lenti like swelling of arms and legs, shakiness, and hypoglycemia. NPH or normal pressure hydrocephalus. It is where the brain has excess fluid that can affect the reasoning and thinking, and also it can have difficulties in walking. It includes also ultralenti like blurring of vision, fainting, and chills. Nursing consideration and its rationale. So the first nursing consideration is that insulin is administered at home subcutaneously. So the rationale for this is to provide patient education about drug effects and warning signs to report to enhance patient knowledge and to promote compliance. The next nursing consideration is that cloudy insulin should be thoroughly mixed by gently inverting the vial or rolling between the hands. So the rationale for this is to ensure uniform suspension of insulin. So the third nursing consideration is that insulin not in use should be stored in the refrigerator but avoid freezing or extreme temperature. So the rationale is that to ensure effectiveness, freezing temperature will break down the insulin and then it will not work well to lower your blood sugar. Next, nursing consideration is that insulin in use should be kept at room temperature to reduce local irritation at the injection site. So the rationale for this is that local irritation which may occur when cold insulin is used. The next consideration is that insulin may be kept at room temperature up to 1 month. The rationale for this is that insulin preparations have preservatives in them, which will keep the insulin good for a while, but eventually stop working and bacteria begin to grow in the insulin and start breaking down the protein. The next one is to select syringes that match the insulin concentration. U100 means 100 units per ml. The rationale for this is to avoid dosage errors. The next one is instruct the client to draw up the regular or clear insulin first before drawing the intermediate acting or cloudy insulin. The rationale for this is to prevent cloudy insulin from entering the clear insulin bottle. So the next nursing consideration is to pre-filled syringes can be prepared and should be kept in the refrigerator with the needle in the upright position. So the rationale for this is to prevent insulin from blocking the needle opening. The next nursing consideration is that the four main areas for insulin injection are abdomen, upper arms, thighs, and hips. So the rationale for this is to make the injections easier, safer, and more comfortable. The next consideration is that alcohol may not be used to cleanse the skin. So the rationale for this is that the insulin needs to go to the fat layer under the skin. So the next is that utilize the subcutaneous injection technique commonly, a 45 to 90-degree angle. So the rationale for this is to ensure that the medication is delivered into the subcutaneous tissue. The next is that no need to instruct for aspirating the needle. The rationale is that the needle should be embedded with the skin for 5 seconds after complete depression. So the next nursing consideration is that properly discard the syringe after use. The rationale for this is that to complete delivery of the insulin dose and to avoid any injury. The next one is the hypoglycemic agents. The mechanism of action is that to increase the body's sensitivity to insulin. Their primary action is the nuclear regulation of genes involved in glucose and lipid metabolism and adipocyte differentiation. The major adverse effects is that the common side effects, the feeling of dizziness, heartburn, stomach discomfort, drowsy, and frequent urination. The nursing consideration and its rationale. The nursing consideration are observed for manifestation of hypoglycemia. The rationale for this is that the drugs may increase hypoglycemic effects, monitor blood glucose level. The next is that assess for allergic reaction. The rationale for this is that rashes and itching are signs of an allergic reaction. Stop taking the drugs and call immediately the prescriber or the attending physician. Instruct to take the medication at the same time each day. So the rationale for this is to make sure the drug is administered properly and on time. The next is to have a caution to avoid taking other drugs without consultation. The rationale for this is to avoid future complications. The next consideration is these medications should never be given to women or to the pregnant women, so rule out pregnancy. The rationale for this is to avoid potential teratogenicity and hypoglycemic effects to the fetus if the mother has type 2 diabetes for gestational or gestational diabetes mellitus. It is because teratogenicity has a substance called teratogens in which it affects the embryo or the fetus when the pregnant mother would take these oral hypoglycemic agents. So the next consideration is that to instruct to wear sunscreen. To prevent, the rationale for this is to prevent skin rashes. It is simply because when taking oral hypoglycemic agents is that the one who will the hypoglycemia is um, allergic or sensitive to sun. And the last nursing consideration is that it advised to bring they are advised to bring simple sugar to be taken when hypoglycemic episodes occur. So the rationale for this is to balance the sugar in the body. That would be all. Thank you.